Okay, so in this short video, I just wanted to address some of the common concerns and questions I get about weight loss injections. Are they safe? One of the most frequently concerns that I hear is that, I've heard of someone that's taken these before and they got really sick. They're really nauseous, throwing up, that sort of thing. And it is true, about 25% of patients do have side effects with these medications. They're usually GI related, the most common being nausea. However, when I hear of issues, it's generally around a patient who was given too big of a dose initially, or their dose was increased too rapidly. And that's usually the issues that I see. So what we do is we don't follow the normal dosing schedule. We start very small dose, a dose that's so small it often doesn't even affect the appetite, but it allows the body to get used to the medication. And then we just very slowly inch it up, and we stop as soon as the appetite's reduced. So we don't automatically go up, up, up. And by doing that, for the most part, if our patients do have side effects, they're very mild and usually just at the beginning as they're kind of getting used to the medication, and then it tends to go away. Any other side effects that might be an ongoing issue, like constipation, is a common one. We usually just do something. You may have to take something, but we do whatever we need to do to kind of counteract that. I don't think I've had any patients at all that have stopped because of the side effects, like they just didn't want to deal with them. So, but side effects are common, but like I say, we usually do some things to make it to where it's not an issue. Another question, or people have often heard or have concerns about their thyroid, hearing that these medications can cause thyroid cancer. So there's no studies in humans that show that these medications do cause thyroid cancer. However, there was a study in rats that showed one particular type of thyroid cancer called medullary thyroid carcinoma was maybe linked to these medications. So just to be precautious, they recommend that if you've had that type of cancer, or if you've had close family members with that type of cancer, that this would not be a good option for you. They would not want you to take it. So no direct link, is in rats, maybe for one particular kind. So if you have that kind, then they would not be a good option for you. The other thing that's been in the news a lot about these medications is that they can cause stomach paralysis. That's called gastroparesis, and that can happen to anyone, honestly. It can happen to whoever. It's more associated with patients with diabetes. So there is, again, no study that shows that these medications cause that. These medications do, one of the main ways they work is they slow your digestion down. And by slowing your digestion down, you are fuller sooner and you simply can't eat as much. So that is a big way that they work. So in theory, if your stomach slowed down, maybe it could cause it to be paralyzed. Again, no direct link, and I've certainly not seen any of that issue with any of my personal patients. I've not heard of it with other providers as well. Not to say it couldn't happen, but again, it can happen to people who aren't on these medications as well. It's just something that sometimes can happen to our stomachs. Again, we keep people on a small dose. So I have one patient that takes the maximum dose, and most of my patients don't take anywhere near the maximum, just enough to reduce the appetite. Another thing is concern about getting these medications from a compounding pharmacy. The reason we're having to get these medications from a compounding pharmacy is because there is not enough of the commercially available product. There's too high demand, they can't keep up, and because of that, the FDA has approved patients to be able to get them from a compounding pharmacy. Also, even if you can get them, the cost is still ridiculous. So they did issue a warning, I think it was last summer, that said to patients, be careful about getting it from a compounding pharmacy, because there are compounding pharmacies that are not FDA approved. I can order these medications and other things from pharmacies located in China, or from pharmacies that are not FDA approved. So that is a possibility. I've seen online places that just go online. I don't even know if you have to see a provider. Maybe there's a provider somewhere in there. You just get your prescription. Who knows where you're getting it from. So that's the concern. We only prescribe from FDA compounding pharmacies. To get that designation, they have to follow what's called good manufacturing process. They're monitored frequently, like they have a review of their pharmacy yearly by an FDA approved person, and they test batch each batch of medication to make sure it is up to the standards that it needs to be. So that is true. You do need to be careful which compounding pharmacy you use, but there are safe, effective ones that are available. The ones that I prescribe to my patients are the same ones that I take myself personally and have taken for over a year now. So those are mostly the concerns that I hear. So as with any medication, I mean, you can talk about Tylenol, Aleve, baby aspirin, anything. There are always risks and benefits to anything that we put in our body. So we have to look at all of those to decide what's best for my patient, what's best for my own health. And you have to look at the risk that we know for sure are associated with obesity and weigh that against the possible risk associated with these medications and any other treatment that we're going to look at. So that's just something that's like we try to go through those things. We look at your medical history, answer all of those so that we can decide if we think it's safe for you, and then you can decide if it's a safe option for yourself. So hopefully that answers those questions. If you have any more, just let me know.